Okay, we're here today with Frida Cook, who is the coordinator for the Community Development Program at Women's Health and Family Services. And she also organizes all of the physical activity programs at Women's Health and Family Services, and that includes some fitness classes. So Frida, could you tell us a bit about the fitness classes you organize?
We run a variety of fitness classes at Women's Health Services and also for other services, so that ranges from things like Zumba and Bollywood to Pilates or yoga. So we have a variety of instructors also who specialise in many different classes.
Okay, and what sort of age groups do you have women coming to your classes?
We have a variety of age groups. In fact, we cover children, preschoolers to school-age students, and young mums, and also people who are seniors.
Okay, and for, do you always do the classes at Women's Health and Family Services, or are they also out in the community?
Some of the classes we run are at Women's Health Services, and we run 2 classes there, which is on a Tuesday and a Thursday at 1 p.m. and those classes are for our clients or people who just want to come along, and it's normally a gold coin donation, or the classes are free. But we also do classes for other services who request a class for their clients.
Okay, and I think there's some photos we have of some of the classes on the PowerPoint here, and that shows some of the women doing their exercises. I think the one on the left, I think you said it was a dance class that was run a little while ago. And you also do some one-off classes for groups. Could you tell me a bit more about those?
We do run those once again for our clients at Women's Health Services, but we get lots of requests from other community groups to go and do classes for them, and it's a good way to get women, or try to get women, actively involved in physical activity. And it helps with their self-esteem and also helps to build their confidence as well.
That's great, and I think there's some photos of those. So there's some belly dancing and some Tai Chi, as well as a drumming group, I think, on the left. So they look like the sort of good fun. But I also hear you do bike riding. Can you tell a bit more about the bike riding?
Well, that was first introduced some years ago now into community development. So we purchase bikes for women who don't have a bike, and so we generally run these workshops during Bike Week, which is in March every year, and we also provide maintenance workshops, so learning how to remove a tyre or remove a wheel off your bike, and also learning how to ride the bikes. And so we also run a social bike ride once we've done those workshops for the women. It's just a very short one, just to get them used to being on a bike path.
Okay, yeah. And I think there's some photos of those. So they look like good fun. And so if people are interested in that sort of activity, so they should contact you.
They can contact me at Women's Health Services.
Okay, and I also hear you run swimming lessons as well, so it sounds like you're very busy.
We certainly do, and the swimming lessons are mainly attended by women with ethnic backgrounds, and this is something that they really never had the opportunity to do this in the countries that they come from. So we have several centres that these lessons are run at. Cannington at the Leisureplex Centre there, also in Balga and in Marawa. So those classes are run during school terms.
Okay. And you also do stalls at health fairs or health awareness days. So what sort of activities would you do at those days?
We can do a variety of different things. So we do massage for the women, and they love to do activities like belly dancing and Bollywood also. So this is a good way too for people to know who we are, and who they can contact if there's anything that they need to know, or if there's any services that they need to use at Women's Health Services.
Okay, so for any of these services, women should contact you. I think there's your phone and email on the screen up there. And you work Monday to Wednesday? at
Yes,
the
I do,
moment?
yes.
So
yes.
the beginning of the week is sort of a better time to
Sure.
contact you. Okay. Well, thank you very much for coming in today. And
You're very welcome.
good luck with all of the activities.
Thank you.
Thank you. We're here today with Christy Law from the Community Development Program. Christy is the dietitian and runs the nutrition program there. So Christy, you run a lot of talks and workshops on nutrition, so can you tell us a bit about those?
Yeah, sure. I go out into the community and run several talks and workshops on different topics. Really depends on what the community group wants and asks for. So some topics that I've done in the past have been on chronic disease prevention, so how to manage, heart health and bone health. Also things like healthy lunch boxes and mother and baby nutrition as well.
Alrighty. And you also do cooking classes, which sound like great fun. So what can you tell us a bit more about those?
Yeah, sure. I do cooking classes for community groups as well, where we demonstrate how to make healthy meals on a budget. So really easy, simple meals that you can replicate at home. And we like to get people involved in that as well.
Okay, so this isn't the MasterChef gourmet cooking, this is...
No, not at all, yes. Just simple, easy meals that you can make every day, yeah.
Alrighty. And you do those workshops for children as well?
Yes, for children, especially during the school holidays, where obviously the parents and the children are available. So we like to do kids cooking activities where they can make simple snacks or simple lunchbox meals, where they can get involved in the meal preparation and really get hands-on with the food as well.
Oh, yeah, that sounds like great fun. And you also do one-on-one nutritional consults for women. So what do women come and see you for?
Yes, so as a dietitian, I have the qualifications to be able to provide dietary and nutritional advice on a one-on-one basis. So a lot of women have come to see me for weight management, so whether that's to gain more weight in a healthy way or to lose weight. For meal planning as well, so for their families if they wanted specific more recipe ideas, for example, any metabolic or hormonal issues. Again, disease prevention, so how to manage high cholesterol or high blood pressure or prevent diabetes. And I've seen a lot of women for gut health issues, so if they've experienced, for example, like irritable bowel syndrome or any intolerances like that.
Yeah. And you've produced some very popular pamphlets as well. So can you tell us a bit more about those?
Yeah, sure. So I produced a calcium pamphlet, an iron pamphlet, a vitamin D pamphlet, and a pamphlet on folate in pregnancy. These pamphlets specifically are very easy to read. There's a lot of pictures in them, and they basically inform about what types of foods are high in these certain nutrients.
And you, besides all of these sorts of things, you take students on practicum placement.
Yep.
And you had a student a group of students last semester doing a project. So could you tell us a bit more about that?
Yeah, sure. So we had a group of students from Curtin University, and they helped us to develop the first stage in a pregnancy resource pack, specifically low literacy. So again, using lots of pictures and simple language. And this resource pack is providing all types of information in terms of with regards to health in pregnancy. And we aim to use it through our health clinic at Women's Health and Family Services.
Okay, so if people are interested in finding more about the pamphlets or perhaps doing prac or other things, so they can contact you at Women's Health and Family Services?
Yeah, definitely. So they can call me, my number's on the screen, or they can send me an email as well, and I'll get back to them that way.
Alrighty, and I think you have some other photos here of a student. So they don't just do nutrition projects, obviously. So it looks like they're helping with some other activities, including bike riding. And so you do take students from a wide variety of placement, from different university courses.
Oh yes, definitely. We've had like health or physical. Physical activity and physical health science students. and also different students doing just volunteer work or placement, and they can be involved in any of the events that we run. So for their example, you've had with the bike workshops or with cooking classes or just general health community events as well.
That's good.
Yeah.
And I've had a look at the Women's Health website, and that looks really good. It looks like there's lots of information, and I think that's a screenshot of it. It also looks like there's a directory, so women, if the Women's Health Services can't help, it looks like there's a directory of services that
Yes.
people can access. So do you have like sort of Facebook as well, or?
Yeah, we do. Yeah, we
Okay.
have a Facebook page. If you looked up just Women's Health and Family Services, you'd be able to find it. And we also have a Twitter page as well,
Okay.
where we just send up-to-dates of all different types of tweets,
Okay.
so that people can follow us if
Alrighty.
they have it.
And so you would put posts of upcoming events or events that you have, and
Yes,
so-
yeah. So it'd be different, basically information about upcoming events, flyers, any of the classes that we run, and things that we're involved in.
Okay.
Yeah.
Well, thank you very much for coming in
You're
today,
welcome.
and
Thank you.
we'll see you at cooking.
Yes, thank you. Thanks.